Shindishna Kaso Gaman Mego Dem Segment Dujaba. Well, I just said my name is Darren McGregor. I'm of the Ojibwe Nation. I am from the Sangmuk Anishinaabe First Nation. And I have been working here at the Neswakmuk Native Friendship Center for 9 years and 10 months and 3 days and 8 hours. One of the things that we do that kind of separates us when we look at Aboriginal housing case management is really the relationship that we've developed and maintained with our homeless clients. Most of the guys downtown all know me by my first name, and I know them by their first name, and there comes a point in time when they're ready. We're going to do what we can. We're going to pull them out. We're going to get them to the necessary resources that are available. We'll say the Friendship Center here has been around since 1967. There's 23 different programs. We have about 32 different staff. We have, if we start upstairs at the third floor, we have an alternative school. We have employment and training workers. And then we have alcohol and drug, healing and wellness. We have court workers. So it's a well-rounded service that we can access and that we can refer our clients to. We say one of the things that we say is we need to know where we come from in order to know where we're going. The cultural aspect that comes with the services is people ask me, what is culture to you? What is cultural relevance? And for me, it's being able to do ceremony whenever I want. It's being able to do the things our ancestors have done on a regular basis without any judgment, without any stigma attached to it. The Friendship Center plays that pivotal role when it comes to providing a culturally sensitive service. We have weekly socials. Every Monday we bring out the big grandfather drum, and our clients come out to it, and they engage in a sensitive environment that promotes positiveness. There's a lot of families, there's little children, and everybody comes together, and that's what a community is, right? And everybody comes together. One of the things that we are looking at doing in the very near future is the Ontario Federation of Indian Friendship Centers, which funds the homelessness program here at the Neswakmuk Native Friendship Center. Mind you, there's two different funding streams. We have the Homelessness Network that provides funding for Wanda Beaudry, who is a non-status member of the Sangmuk Anishinaabe First Nation, and we also have myself and Olivia Perry. Olivia Perry is Cree from the Moose Factory First Nation. And the three of us work together in the same office, work together in the same program. It's just there's two different funding streams coming in from that. So, where was I? I lost my train of thought. I got derailed there. Okay, the Federation of Indian Friendship Center will be providing some Train the Trainer. So it's a little program called ACDC. So it's like an Aboriginal competency development curriculum. So they're looking at training some of the First Nation staff members here in the Friendship Center to be trainers to go into different organizations to provide culturally competency training. So we've applied for it, we haven't had an answer yet. So that's one of the things we're looking at doing when it comes to working with the city and working with organizations in the city to provide some services. So when we look at that report card, one of the things that I mentioned earlier is we need to know where we come from in order to know where we're going. That report card pretty much says a lot. So when we see that 44.5% of the Indigenous population indicating some sort of Aboriginal ancestry, that it kind of makes sense. We need to know where we're coming from in order to know where we need to go. So, being in the field here for about 10 years, I've experienced a lot of not so friendly landlords. Heard many stories of our clients who've been out in access services that really, really hit the soul. And we do what we can by listening to them and doing what we can by advocating on their behalf so that they can feel comfortable in accessing services and they can feel comfortable in getting the help they need. So, to keep us on track, I will wrap that up. And be watch.
Now I'd like to invite Tina Ranta from the Canadian Mental Health Association to talk about the Harm Reduction Home Day Program.
Hello, thank you. Pardon my tardiness. I have a malfunction with my presentation. So I'm grateful that our agency is just across the street because it wasn't much for me to run and get these PowerPoints. So I'm just going to speak a lot to the program. The PowerPoints, there isn't really much we're missing out there. It was just a lot of talking points that I'll be discussing. So my name is Tina Ranta. I'm a registered nurse and I work with the Canadian Mental Health Association. The majority of my nursing career has been working with homeless populations across Canada, actually, in Halifax and Toronto. And now we have relocated to Sudbury, and I'm so glad to be able to provide that same support and services to this community as well, too. And I'm from Timmins originally, so I am northern. Like I said, our agency is the Canadian Mental Health Association. We're just across the street at 111 Elm Street and Suite 100 for any services through there. So similar to what Gail Spencer was talking about earlier with the study that was done with the LIN, in which the out-of-coach shelter was the first phase of that project. The project that I'm going to speak of, which is the Harm Reduction Home Day Program, was the second phase that came out of that community gathering as well too. So we are opening a day program, which is going to be located at the annex, which is where the out-of-the-cold shelter currently is. We're operating in the daytime hours, while the Salvation Army is using the evening hours to provide their services. So that is located at 200 Larch at the old police station. If anybody knows where that is, that's on the corner of Larch and on Paris as well too. Most people don't know where that is when you say that. So our estimated start date for our program is to be commencing sometime this month. We're currently confirming our physician availability so that we can get our program up and running. Our hours of operation will be from 8:30 a.m. to 6:30 p.m. And we will be open 7 days a week, 365 days a year. So our program, some of the services that are available through our program, we're serving a very specific population within community. So we are opening a managed alcohol program and providing those services within the harm reduction spectrum to individuals that are homeless and impacted by alcohol dependency as well. So we're looking at the space to accommodate up to 8, but we're gradually starting and leaving that very open for how many individuals we'll be able to accept into the program, keeping safety our #1 priority with providing services. So services that will be available to individuals there will be primary care, access to nursing care, the managed alcohol program, in which we'll be dispensing alcohol hourly from the hours of 9 a.m. to 6:30 p.m. based on a physician's medical order. So we're treating alcohol as a medication for these individuals to help sort of with the dependency and help them gain control over their alcohol consumption. We're also looking into a tobacco program as well too for the program. We'll provide medication management. We have a case manager to help with case management support as well. Also helping with support for income, support for accommodations, access to a variety of programming and activities dependent on what the needs of the individuals that are enrolled in the program are. We're also offering 3 meals a day along with snacks, groups, and we also offer multilingual and cultural adaptations to a lot of our services. We have Francophone staff. We have a whole bunch of languages within the staff itself, and we're also partnered as well too with Shakamakwe and also Ms. Wakamak as well too, for helping get in those cultural adaptations into the program as well. We're also offering outreach as well. So even though our doors close at 6:30, staff are working till 11 o'clock at night. And during that time, we will have a nursing staff and a frontline staff as well too, engaged to help check up on people for safety as well too. Also partnering with the Salvation Army to help provide support to the Out of the Cold shelter as well. And also supporting RESO Access and SASE with their outreach that they already do throughout the week in the community as well. So operations of the program, alcohol dispensing, which we call POURs, are based on an individualized schedule based on physician's assessment. So they're essentially dispensed every hour. If there's a risk or if the individual's too intoxicated, then we hold, but that doesn't limit them from not being able to receive their next pour within the next hour. So that's monitored very precisely with nurses and also with the physician consult with that as well too. We're looking into dispensing the tobacco twice daily, and we're also looking into opening an open house sometime in December in collaboration with the Out of the Cold as well, so the community will be able to come during daytime hours and sort of see how both programs share that big, wonderful space together. So a bit about managed alcohol programs. So I think it's a really important aspect to look how progressive we're being in Sudbury. So this managed alcohol program is the 5th to open Ontario and the 6th nationally across the country. So I have to say very great thanks to our Northeast Lynn and also for the community for the support in being able to be progressive and really provide services to individuals that require this help within the community. Eligibility criteria. So we've looked at a lot of the eligibility criteria with other programs and other maps and essentially mirrored a lot of those. Currently, individuals need to be homeless, street involved, or risk of homelessness. So street involved means that an individual can be couch surfing and still being involved in activity on the street. So that's an appropriate individual as well for the program. They must be able to have their care safely managed within a community setting. Need to have the desire to participate in the managed alcohol program, so nobody can be forced into the harm reduction home to do treatment, so it can't be court ordered, and they need to be willing to come and participate. Obviously 19 years of age or older because of the legal drinking age in Ontario. And individuals must also have an income to assist with residential and alcohol expenses or be willing to obtain income through the support of our case manager to sort of help fund that program and to have that buy into the program as well too. There's sub-eligibility criteria, also in which individuals need to meet 2 points of that criteria. But that helps us also with identifying risks. So when individuals are applying to the program, we're able to identify who's higher risk. So those are available on our website, posted for everyone to see as well, and I can just give a few points of some of them. So individuals that are consuming non-beverage forms of alcohol, that's a very high-risk behavior, whether that be cooking wine or Listerine, anything of that sort. Individuals with complex health concerns that aren't being addressed due to their alcohol use. Individuals that are frequent users of emergency police services, social services, that's impacted by their alcohol use as well. And also individuals that are restricted or barred from other community resources due to their alcohol use as well. We will gladly accept those individuals. And also any health concerns, seizures, liver disease, acquired brain injury, anything else that would come along with the use. So currently our referral process, we sent out an email this morning to community partners. We had started the referral process a couple of weeks ago, and we ended up getting 2 applicants that are currently waitlisted to come onto the program to start. And we decided that the referral process that we did wasn't working, we weren't capturing people. So now we've just sent out an email and now it's open. So we're just accepting referrals any day of the week and waiting until we get our full list and capping off. So I have little cards for the program. I see Mr. Stevens in the back there. If you want to see me afterwards, come get some cards, please. And if anybody else has anybody or they work with anybody that would be a good benefit to the program, please just come see me and I can provide some of those as well. So essentially we email to a lot of our referring and partnering agencies to let them know that we are ready to take people in and Individuals can refer themselves as well too. They don't need to come with a referring agency. And they'll actually meet with our intake staff at CMHA, or the staff there can also go and meet the individual where they're at. So the biggest portion of our program is really just meeting people where they're at, seeing what they need and helping facilitate that the best we can. And our future plans. So currently, this is our pilot program. So we're running this currently while we're still looking for a full 24-hour program. Our aim for the program is to be able to have our residents, to be able to have them living within the facility for a 24-hour period. So currently we're aiming to operate a 15-capacity residential building by the summer of 2016 that can provide the 24 hours support for the specialized population. So we'd like to thank Lynn again for the funding and the support and so much addictions programming that's going on in the community, and thank you for the city for your partnership, for providing the space, and that's about it. So, thank you.
Well, thank you all for coming, and